This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about hormone panels. Sometimes it can feel like our lives revolve around our hormones, and that goes for all genders. They affect everything from energy levels to mood, sleep, sexual desire, and beyond. And when things feel physically and emotionally out of whack, our hormones might be to blame. So, is correcting a hormonal imbalance the solution we've all been searching for? And is it worth shelling out potentially hundreds of dollars to get a hormone panel? This episode, we're hearing all about hormone panels from Dr. Ekta Kapoor. She's an associate professor of medicine at Mayo Clinic College of Medicine who specializes in menopause and hormone therapy. She works with people experiencing endocrine disorders, menopausal symptoms, sexual dysfunction, and more, and she's here to tell us what a hormone panel can and cannot do for our health. Dr. Ekta Kapoor, thank you so much for joining us today. Welcome to the show.
It's my pleasure. Thank you for having me.
So, Dr. Kapoor, it seems like everyone is having hormone panels done now. If not having hormone panels, talking about having hormone panels done. Why do you think these tests have become so popular?
I think it is mostly being driven by this perception that the female hormones have to be in a certain range or at an optimum level in order for a woman to have good control of her menopause-related symptoms. And I think even more importantly, for long-term health. So there is this perception that if the hormone levels are in a certain range, that is good for long-term heart health, long-term brain health, and bone health.
I'd also say that it seems that we are in a moment where menopause is being talked about more openly than it has historically. And for a lot of people, their entry point to talking about menopause is like, oh, are my hormones where they're supposed to be? Have you found that to be the case?
Oh, 100%. That's a very common statement that I hear from patients. They will come and say that my hormones are out of whack, or can we check them to make sure they are where they need to be?
Let's talk more specifically about what hormone panels are and what makes them comprehensive. I'm saying that in quotes. I mean, what does the term comprehensive actually mean in this context?
I'll start out by saying that there is no such thing as comprehensive hormone panel testing. If anything, there is a very limited role for checking female hormones. I mean, there are very specific situations where these levels are actually helpful, and that too of certain specific hormones. But in general, measuring these hormones for the most part is uninformative. Second, it does not change outcomes. So in general, they cause confusion, they cause fear, they cause worry, and really do not advance the medical care of the patient.
Okay, so everybody who's out there saying, I need a hormone panel, you're saying, not necessarily, and they can't necessarily be as comprehensive as you want them to be. What are they supposed to be measuring, though?
That's a loaded question. So let's talk about this on the basis of the specific clinical situation, for example. So let's say a woman who's going through the menopause transition, her predominant female hormone, which is estrogen, fluctuates a great deal. So one day it may be very high. In the next couple of days, it may be close to zero. That's just the nature of the hormone fluctuations during the menopause transition. Depending upon which day the person has the blood draw, you may catch them at a time when it is very high, but if you check it 2 days later, it may be very low. So what are you going to tell the patient on the basis of a single blood draw? And then the other thing is that a certain hormone level does not dictate a certain type of symptom or the intensity of the symptom. Different women have different sensitivity to estrogen when it comes to how predisposed they are to breast tenderness, breast soreness, emotionality, low mood and headache. Some women experience it when their estrogen level is very low. Others will experience it when the estrogen level is very high. Others will experience when there is a fall from a high to a low level. So as an example, the most common symptom of menopause, hot flashes and night sweats, they do not correlate to the estrogen level, meaning you cannot say that, oh, somebody who has a lower estrogen level will have worse hot flashes and night sweats. It doesn't work like that. So the point being, there are no defining levels that I can say if a woman's estrogen level is A, she should have B and C symptoms. It's not like a mathematical equation. That same level of estrogen may produce very different symptoms in another woman and may cause no symptoms on the other person. The most important piece that will help you take care of the patient will be a detailed history. What are your symptoms? What time of the cycle are you experiencing those? What is the character? How severe are those? Those things will help you manage the patient much better than any hormone level.
So when can hormone testing actually be beneficial?
So let's give you another example.
Yeah.
A woman who's experiencing premature menopause. So going through menopause prior to the age of 40 years. This is a woman in her 30s and she's having hot flashes and night sweats. Now, she should not be having hot flashes and night sweats in her 30s. So before we tell her, hey, this could be because of menopause, we need to be sure that this is because of menopause because this is a big diagnosis. It has implications for her long-term health, her heart health, her brain health, her bone health. So in those situations, hormone testing is useful. And there we check the levels of what we call follicle stimulating hormone, FSH for short. This is the hormone that stimulates the ovaries for growth of follicles, which ultimately results in ovulation. So when the ovaries are not doing their job, there's a feedback to make more of this hormone. So women who are experiencing ovarian insufficiency have high levels of FSH. So that becomes a defining piece in the diagnosis of premature menopause or premature ovarian insufficiency. So in that situation, it is of value to get that number because then I can confidently tell her, hey, looks like your ovaries are not doing their job properly. And that may not only cause you symptoms, but it may also have an impact on your long-term health. So I think you should be using estrogen replacement therapy. I'm not just treating her symptoms. I am treating a hormone deficiency.
So for that example of the woman in her 30s experiencing menopausal symptoms, you would measure her hormones. But I'm just curious, what would you do then for a woman in her 50s with the same symptoms?
A 52-year-old who comes to my office complaining of hot flashes and night sweats, there I know that she's probably experiencing these symptoms due to menopause. Their hormone testing will not really help me. It really doesn't matter where her numbers are. I would be treating the symptoms. If her estrogen level is low, I would still treat those hot flashes. If that estrogen level is high, I would still treat those hot flashes. You see the difference?
That makes sense. Yeah.
One more exception I'll share with you. Let's say individuals who've had their uterus taken out. So you cannot gauge where they are in their reproductive stage because there is no bleeding. This is a person who is, let's say, 46, for example, and they're having hot flashes and night sweats. Because you cannot rely on the bleeding pattern, there may be some value in checking an FSH in this person to see, is she making the menopause transition or not? By checking that hormone level, you are advancing the care of the patient. You are gathering more information which will help you with decision making.
So when you have all these different types of cases, how do you go about deciding when it makes sense to test hormones in your practice?
In our clinical practice, we have to ask ourselves, how is this going to advance my knowledge about the patient? And how is this going to alter what I do for the patient? And if the answer to both of those questions is no, then there is no point checking it because it will just cause confusion and fear and worry and add to the healthcare costs. So it really doesn't benefit anybody. So I think that there is value in checking a hormone level if you are going to do something about it. Meaning, if the level is low, you're going to give the person back that hormone so they can come up to the normal level. Or if it is high, you're going to do something to bring the level down. So if my thyroid gland is overactive, making too much thyroid hormone, and I'm having symptoms because of that, then I have to find out why that's happening and then use ways and means to get that hormone level down because too much thyroid hormone causes long-term adverse health outcomes. Similarly, if my thyroid hormone is low, then I have to supplement it. If that hormone level is something we need to act upon, then there is a point in checking. But if checking the level is just an intellectual curiosity question and it's really not going to change what we do for the patient, then there is no value in checking it.
That all makes so much sense because if you're treating symptoms, which you said people in menopause, it's really about treating those symptoms, you don't need to know the exact number of what the estrogen is today or even yesterday or the day before. You need to know these symptoms are valid and we're going to be treating them as such. So why do you think these hormone panels have become so popular if they don't really inform treatment for most people?
The reason why these panels have become so popular is it's a marketing gimmick, it's a money making business. And like you said, menopause is having a moment, people are talking about it. There is so much on social media. So the way these things are marketed, it's your hormones that are causing you to gain the weight, it's your hormones that are causing you to age. And if only we could fix this piece, all of this would go away. This would be an anti-aging intervention, anti-cancer intervention. So patients fall prey to all of these pitches because there are healthcare professionals or providers out there who are propagating this message and leading patients to believe that the hormones have to be in a certain range. So they will check all sorts of hormones and all sorts of body fluids. They'll check it in their saliva, they'll check it in their urine, check it in their blood, in places where these levels are not even standardized. And so they create these fancy reports for the patients that are color coded: red, green, yellow. Red meaning this is a bad level to have, green is this is a good level to have. Then they make recommendations. Because your hormones are out of whack and they're not in range, let me put you on A, B, and C to get you back in range. So ultimately, it's a pitch for putting people on these hormones, the custom compounded ones. So that's where all of this is coming from.
Hormone tests are only necessary when knowing the hormone levels will actually inform your treatment. If you're experiencing things like premenstrual or menopause symptoms, for example, you'll probably be treated based on your symptoms rather than the hormone levels themselves. In that case, checking hormone levels won't really do much for you. It does make sense to check hormone levels when diagnosis or treatment directly involves the hormones at play. For example, if someone is experiencing premature menopause, knowing hormone levels is important because the treatment may involve estrogen replacement therapy. So there are some times hormone levels can inform treatment. Let's learn more about those instances, what doctors may check, and why. Well, other than FSH and thyroid hormone, are there any other hormones that it's useful to measure?
There are a range of hormones depending upon what their symptoms are. For the most part, low and high hormones are both problematic. So if a patient is presenting to you with very characteristic symptoms of a hormone deficiency or a hormone excess, then those levels have to be checked and managed appropriately. Adrenal glands make cortisol. So people with cortisol deficiency have Addison's disease and they can have very dramatic symptoms: nausea, vomiting, abdominal pain, weight loss, etc. And that's diagnosed by checking the level of that hormone. Similarly, the adrenal glands could be overfunctioning, making too much cortisol, which can also cause some bad symptoms and adverse health outcomes. The tricky part comes with the female ovarian hormones because depending upon what time of the cycle you're checking your hormones, you're going to see some variation. But again, checking those levels really does not tell you about the health of a woman. If she is having regular menstrual cycles, that is the most important marker of normal ovarian function. One more hormone that deserves mention specifically for women's health is something called anti-Mullerian hormone, AMH. It's a marker of ovarian reserve. So let's say I have a young patient who's having some symptoms of menopause, hot flashes, night sweats, etc. Her cycles are irregular. I get an FSH that's kind of high, but not quite meeting the threshold for diagnosis of ovarian insufficiency. You can check an AMH level to see what her ovarian reserve is like. Women with PCOS tend to have high AMH levels, and the ones who have ovarian insufficiency, infertility, subfertility have low AMH levels. So if their patient has a low AMH level, that's corroborative evidence that she could be experiencing ovarian insufficiency. And for a patient like that, I might have a lower threshold for giving hormone replacement therapy to her. Now, the caveat here is an important one, that the diagnostic cutoffs for establishing ovarian insufficiency with respect to AMH have not been established, meaning there is nothing to say that, okay, if the AMH is below this cutoff, this patient has ovarian insufficiency. The middle range levels don't really tell you whether the patient has ovarian insufficiency or not. But if you get an undetectable AMH, then that helps you.
What about testosterone?
So, females make testosterone in their body, but it's about 1/10 of the amount that men make. And the testosterone in our bodies, half of it comes from our adrenal glands and the other half comes from our ovaries. Now, measuring testosterone levels in women is problematic. Most people don't have access to those sensitive assays which can differentiate a low level from a very low level. Even if we do measure it, there can be two women in the room with the exact same testosterone level, and one may have symptoms of sexual dysfunction because of the low testosterone, and the other may have nothing. So if a man comes in with symptoms of low testosterone, loss of muscle mass and lack of libido, etc., you check the level is low, then you try to figure out why the level is low and then treat as appropriate. But the same does not apply to a woman, because we do not know what could be the consequences of a low testosterone level for a woman. It's not like if you check it and it comes back low, then you can say that, oh, her low libido is because of low testosterone, because there are 100 other causes which are much bigger players for a low libido in a woman than a testosterone level is. By contrast, women with PCOS, polycystic ovary syndrome, have high testosterone levels, but that doesn't mean they have great sexual function. Many of them, in fact, have very bad sexual dysfunction because they may have body image issues related to their weight or acne or hirsutism.
So it sounds like with a lot of hormones in females, there's not really a universal meaning to having a certain level. It can be way too low or way too high, but somewhere in the middle is harder to interpret. Is that right?
When it comes to women, hormone levels can be difficult to measure. There are nuances to measurement, and the level does not dictate symptoms. So that is why female hormone deficiencies, if you can call it that, it's hard to diagnose them and treat them, with the exception of premature ovarian insufficiency, which is like deficiency of estrogen in a young woman. But outside of that, midlife woman, a woman with low libido in her midlife years, checking hormone levels and acting on those is more nuanced.
So there are a few cases where it does make sense to have a hormone panel to determine endocrine deficiency, hypothyroidism, a few other select cases. But the rest of us who are being marketed to get a test kit at home, we probably shouldn't be doing those test kits.
I don't think so, because it's very important to have a detailed discussion with your healthcare professional. Sit down, talk about your symptoms, and decide what's the best testing for you. Because A, testing may not be needed in the first place. B, even if we do testing, these at-home kits really haven't been calibrated, haven't been validated to know that they're actually testing what they are saying they are testing, right? So unless we have that confidence level in this kind of testing, I think it's just a waste of time and money.
There are some hormones that are useful to measure in specific cases. These hormones include FSH, thyroid hormone, cortisol, AMH, and testosterone. But these should be tested on a case-by-case basis depending on what symptoms you have, not necessarily as routine. When we do test certain hormones, we might know what it means if that hormone is too low or too high, but we know less about what a level somewhere in the middle means. The relationship between hormone levels and symptoms in each person is highly individualized. But with all that said, you might have a very real reason to want a hormone test. So let's talk about how to bring that up with your doctor. Okay, so let's say somebody does think, you know what, I don't know exactly what's going on, but I really feel like I need a hormone panel. What should they do?
I will say that in general, I want to steer people away from this idea of panel testing. Because you know what the genesis of panel testing is, right? I'm going to get my lipid panel, I'm going to get my glucose, I'll get a genetic panel and what have you. I don't think this analogy can be applied to hormone testing, because hormone testing really has to be dictated by symptoms. Now, there can be situations where somebody can have a deficiency of multiple hormones, or they can have excess of more than one hormone. But generally speaking, people do not present with hormone abnormalities in multiple glands. So what I would tell people would be sit down with your healthcare professional. The discussion has to be centered around the goals of seeking care. If I want to have my thyroid hormone tested, why do I want to have it done? Rather than just blanket ordering of all of these tests, it has to be dictated by people's symptoms.
And once the doctor determines you have certain symptoms, these symptoms indicate that I should test for certain hormone levels. For example, maybe there is a chance that there is hypothyroidism here. Is it a blood test? Is it a certain time of the day that it's done? Is it multiple times throughout the month to determine a baseline? What exactly is happening then?
Depending upon the clinical situation, this could be testing in the blood more commonly, but sometimes we also need urine tests. So as an example, if I'm concerned about my patient having hypothyroidism, the first and the only test that most people will order will be a TSH. So that's thyroid stimulating hormone that comes from the pituitary gland. And that really doesn't matter what time of the day you do it. If the TSH is abnormal, then you got to follow it up with actual thyroid hormone testing, which would be a thyroxine level. On the other hand, let's say I'm thinking about a man having a low testosterone level based on his symptoms. That's like a morning check of testosterone. Depending upon what the level is, if it's kind of borderline, it may have to be repeated. Similarly, if I'm worried about a person having a cortisol deficiency, then I want to check an 8 a.m. cortisol level. On the other hand, if I'm concerned about somebody having too much cortisol, the first test typically is a 24-hour urine sample. With excess cortisol, you have to sometimes check in their saliva also. So it really depends which is the hormone in question.
The message I'm getting is that the whole idea of hormone panels, they just don't make sense because everybody has different things that they're trying to treat. And in a lot of cases, hormones don't need to even be tested at all. And when they do need to be tested, they need to be tested in totally different ways, depending on what hormone we think is in question here. If testosterone is being tested for in this way, while cortisol is being tested for in this way, how could there possibly be such a thing as one panel for everything?
Exactly. And then anytime you use the word panel, I mean, the idea of checking the panel is that the things are somehow related and the conclusion will lead to a treatment which will be somehow related. But that same thing cannot be said about hormones because they have very different functions in the body. Their deficiency or excess produces distinct symptoms that are managed very differently. There is really no valuable information to be gained by checking all hormones all at once in a single kit, etc.
Everything you're saying makes so much sense. Hormones are not the same thing as a lipid panel. It's a totally different ballgame that we're dealing with here. But as a provider, you must hear these hormone panel requests from patients all the time. And I'm guessing these requests are well-intentioned from people who just want to get a fuller picture of their health. So how do you navigate that conversation where you want to honor that goal, but also correct any misconceptions?
Sometimes those can be very challenging discussions to have with patients. And we tell them that just measuring your level and trying to manipulate that level is not going to make you feel better. The most important thing right now is I want to hear your story and see what I can do about it. And not everybody believes you at first when you tell it to them like that. They have been fed this information from so many different sources. So just one person telling them otherwise is not going to do the trick.
It's like, but I've read everywhere I need this. Why won't you do this thing for me, Dr. Kapoor?
Exactly. It's just the click of a button. might tell people that, yes, of course, it's very easy for me to order this and I'm happy to order it. But then I present scenarios to them that if it is high, if it is low, I don't know what I'll do with it. But here is my proposal. Here's what I want to do for you. You're telling me you're not sleeping well. You're telling me that you get headaches before your menstrual cycle. And here is what I can do about it. And here is what we're going to do. And I'll bring you back in 2 months and then we'll have a conversation. When these people are feeling better, when you see them in follow up, then it's a different tone to everything. They are more in your camp. But there can be so much skepticism when you see these patients at first. And then a lot of times, patients who have seen providers and have had hormone panels done and have been put on custom compounded hormone treatments, particularly pellets, those are some of the most challenging discussions to have with patients.
Yes.
If a woman is given too much testosterone, chances are her libido will go up, her energy level will go up, her muscle mass will go up. And as you can imagine, these are desirables for women in their 30s and 40s, and even older women sometimes. So she's sitting in front of you and she's saying that I started using these testosterone pellets and I can exercise a whole lot. I feel that I look much better. My intimate life is much better.
Mm-hmm.
So a lot of times it can be difficult conversations to try and convince patients that we actually don't have any safety and efficacy data of testosterone use in women using it long-term. We don't know what that does to their long-term health.
But I imagine that must be demoralizing for some patients who really feel testosterone is helping them. So how do conversations like that usually turn out?
How such discussions end up with patients are highly variable. Some people are more willing to take your recommendations, and then there are others who are not. And at the end of the day, I think patients are trying hard to do the best things for themselves. They want to take care of themselves, which I think has to be respected. I mean, you can expect superior outcomes when the patient is as involved in their care as their healthcare professional. So patients advocating for themselves is a good thing. But then again, all the misinformation and the disinformation, that is problematic now. It's very important to have an empathetic view, to understand where the patient is coming from, and make sure that the patient has the confidence that ultimately they get to make the decision, because people want to be making their own decisions like they should be. So I sit down with the patient and give them the evidence, the pros and the cons. I talk about studies and then give them the assurance that after hearing all of this, ultimately you get to decide and I will hold your hand regardless of what your decision is.
You know what's interesting is people try to sell us various health solutions and products all the time, but not all of them have caught on like hormone panels have. I've seen influencers and celebrities mention them left and right. Why do you think this idea specifically has stuck?
Individuals going through menopause have been dismissed for a long time.
Mm-hmm.
They've been told that these symptoms are to be lived with. And they've been given the impression that you shouldn't be talking about this stuff to anybody. There is this stigma, there is a sense of embarrassment. The other thing is that the messaging around female hormones over the years has been problematic. This fear-mongering surrounding hormone therapy use in women has gone on forever because women would be experiencing bad menopause symptoms and the people who were taking care of them were scared of giving them hormones because they thought it causes breast cancer, it causes heart disease. And then there is this lack of education and the perception that there are no other effective treatments out there. So what do the women do? They look things up. They Google their symptoms. They go to social media. And then they find things that, oh, okay, my provider would not prescribe hormones to me, but here is somebody who actually checks hormone levels and acts on them and gives custom compounded hormones that are just right for me. Who wouldn't jump at an offer like that, right? Especially if they felt like their symptoms haven't been heard and validated. So, I get that. Patients come in with the impression that there are no FDA-approved products. There are FDA-approved hormone formulations that are used for these exact same reasons. That's why making the patient understand that there are safe ways of doing it. And I am willing to prescribe hormone therapy to you, but we just want to do it in a safe way. But, I sit here and say that like that's the easiest thing to do. It's hard because this evidence is changing. This landscape is so dynamic. Every day we have new studies coming out. It's not easy.
So there's a lot of fear-mongering, dismissal, and misinformation surrounding menopause. And that's driven people to seek solutions outside their provider's office. This is clearly a larger systemic issue in healthcare, not just a single doctor's office. What do you think the solution is?
That education piece has been lacking, and I think it still is, that it's not about their hormone levels. Their symptoms are valid, but it's not about the hormone levels.
Mm-hmm.
Patients in today's day and age, if they are set and determined that they want something, they will get it. There is access to all sorts of information, all types of prescription therapies. I mean, you can order hormone therapy on Amazon, right? So I'd be living in a fool's paradise if I think that, hormone therapy use is not safe for her. I'm not prescribing it for her. If I don't do it and she really wants it, she will get it one way or the other. But then there is that risk of getting it in an unsafe manner. So I think if we want people to utilize these products in a safe manner, there is so much value in counseling, giving them the evidence of the pros and the cons. So ultimately, the patients have to be the captain of their ships, and that has to be very clear in our encounters with them.
So all the patients out there, we should advocate for ourselves. We should all find somebody who's as good as you, Dr. Kapoor, who takes our symptoms seriously and not necessarily think of hormone panels as the answer. Think of symptoms that need to be addressed. You don't need to worry about a hormone panel. A hormone panel's not even going to give you what you want. It's great to hear it from you.
Wonderful. Thank you. It was a pleasure to meet you and do this.
So if your provider is hesitant to order a hormone panel for you, there might be a couple reasons. First, different hormones are best tested in different ways, so there's no one panel that's going to get the most accurate picture of all your hormones. Second, if testing hormone levels isn't going to help you meet your treatment goals, your provider probably doesn't want you to spend time and money on information you won't be able to act on. However, a good provider should take your symptoms seriously, listen to your concerns, and be willing to go over the pros and cons of various treatment options with you. You don't have to settle for being dismissed or for fear-mongering. Find someone who's willing to have a dialogue and be your partner on the path to safe and effective treatment. Okay, that's all for this episode. But if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/Health Matters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy.